Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
And I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're speaking with Christine James. Christine is a mother of two daughters, aged 19 and 23. She has been a nurse for 8.5 years, and she has a chronic illness, and she is a chronic pain patient. She's here today with us to bring awareness to a rare and largely unknown disease called complex regional pain syndrome. I think we only spoke to one person so far with that. Christine, thank you for taking the time to share your story with us today.
Thank you for having me.
You're welcome.
Christine, let's, I guess, just jump right into it. What symptoms first led you to seek out medical care?
Well, I had a surgery on March 12th of 2024 for my ankle. That was a result of having a damaged spinal nerve 10 years ago, which caused me to have foot drop. And for 10 years, I walked around on my leg, and over time, it broke down the structure of the bones in my ankle. It developed arthritis, and I was having more and more daily pain and swelling. So I sought evaluation from 3 different doctors before choosing a very good surgeon, orthopedic surgeon, and he performed several procedures in one. He did an ankle fusion to eliminate the bone arthritis and pain and swelling. He also did a tendon transfer to allow me to hopefully develop a little bit of ability to lift my foot again. And he also made several small incisions in my Achilles tendon to lengthen it, because over 10 years of not having any lift in my foot, that tendon on the back of my leg had tightened.
Oh my God.
So, yeah. So, in previous history, I've had 6 back surgeries with a fusion at L5S1, been diagnosed with degenerative disc disease and osteoarthritis in my spine. So, since having so much experience as a nurse and having experience having so many surgeries, after this ankle surgery, I was very surprised at the level of pain I was in. And after they changed guidelines for pain medications in 2016, all of my surgeries had been prior to that. It was very hard for me to get pain control. So I was kind of confused and really evaluating a lot during those first few weeks. They had me in a splint until the swelling went down enough for them to put me in a hard cast. So on April 7th, I had been in a hard cast for about 10 days. And that was a Sunday. And I very suddenly began to feel extreme intense pain like I had never felt before very quickly. I felt my leg was re-swelling inside of the cast. I felt like it was literally on fire. I began crying, panicking. I called my surgeon, and they told me to go immediately to the emergency room and have the cast removed. I did not have a good experience in the emergency room. The doctor there was very rude. He actually chastised me and said, "Why didn't your surgeon call and tell me you were coming? Now I have to go make a phone call." I was crying.
Wow.
I was crying and shaking and in incredible amount of pain, saying, "Do I have compartment syndrome? Do I have infected hardware? What is going on?" So when he walked away, my boyfriend was with me, and I was crying, and I said quietly to my boyfriend after several moments, I said, "I don't think he's listening. I don't think he believes me." And he heard me from across the ward on the other side of the curtain, and he yelled, "I just need to know what to do to get you out of here."
Oh my God.
Wow.
Can I ask what hospital that was?
Well, I don't know if we should...
That was St. Joe's Trinity Health in Howell, Michigan.
Oh, okay. They're
And I
good
did
for
leave-
they're good for hearts there, but maybe not orthopedics.
Yeah.
I don't know.
That particular doctor, I did go and look up reviews, and I did leave a Google review on that particular doctor
Yeah.
because there are good doctors there as well,
Right.
but he was not nice to me.
Okay.
So after the removal of the cast, they just sent me home, and I was instructed to go directly to my surgeon as soon as they opened the next morning.
Okay.
Okay.
I already owned a walking boot, so I had been told by my physician's assistant of my surgeon to take that along, put my leg into that, and present myself the next morning, which
Sure.
I did. So my leg was protected.
Good.
And when I got there, I described my symptoms. I have a very caring, understanding, and knowledgeable surgeon. He's excellent. And I said the same things to him. I described my symptoms. He took a look at how red and purple and swollen and everything. And I'm very articulate when describing my symptoms. And he said, this does not look infected. This does not look like compartment syndrome. This is complex regional pain syndrome. And I'm a nurse. I've never seen a patient with it, never heard of it. And I said,
Okay.
what is that?
Mm-hmm.
I said, can you write it down? And he said, I'm going to refer you for a spinal injection. And I'm going, okay, I've had plenty of spinal injections. So I didn't panic. And I went home and I started researching, and that's when the panic began. So yes, from there, I learned that this is incurable and a progressive disease that is very misunderstood and not largely well known by most doctors and medical professionals. The first doctor that my doctor referred me to said, I don't even do the type of injection. You need a sympathetic nerve block. I don't do them. So I saw like 2 other pain doctors and then began joining the online community and doing my own research. I did have to go through 2 sympathetic nerve blocks. This is not best practice, but a lot of insurance companies and doctors still don't fully understand this, and they consider it a test because CRPS, especially if you're early stages, does immediately interrupt your sympathetic nervous system. So a sympathetic nerve block means they take a very long needle and go all the way around your spine to where sympathetic nerve ganglion are. They sit on the front side of your vertebrae. And they inject basically a local anesthetic similar to lidocaine to try to interrupt the misfiring of your nervous system to kind of test and see and verify that if this works for even 10 minutes, that's a positive result for CRPS. However, if you are a patient that has gone without diagnosis for years and your CRPS has spread, and this method won't work to test for it, but it
Okay.
did work for me. So I immediately began exploring treatment options. As a nurse, I knew already the dangers of things like spinal cord stimulators, and I absolutely refused. I met another pain doctor in Michigan who told me he refuses to prescribe any type of opiate or controlled medicine whatsoever because he has seen other doctors being arrested and thrown in jail. And he offered me a spinal cord stimulator. I said, I want my $40 copay back because
Right.
when I called your office, I specifically asked, do you prescribe? Because at that point, my surgeon was saying you need pain management, and I can only prescribe you medication for so long. And I'm looking for a doctor who has options for me. This doctor did not. He was in Flint. That was a waste of time.
Okay.
So I found my doctor by joining Facebook groups, my Michigan doctor. I opted to seek out ketamine infusions
Okay.
because I did my research.
Mm-hmm.
Complex regional pain syndrome does interrupt your central nervous system, and you do see immediate changes in your sympathetic and parasympathetic nervous system. These are all of the things that do everything automatic in your body.
Right.
So everything automatic is immediately affected, and you also will soon see interruptions in your endocrine system and your immune system. So when you add those three things up, those are the three systems that send chemical signals throughout your body to tell it to work the right way.
Mhm.
So it took a lot of studying. It took hours and days of watching YouTube videos, talking to people. I have a stack of books I've checked out from the library. I worked very hard and fast through the worst pain I have ever felt in my entire life, and found one of the top doctors in the country in Florida who takes insurance
Oh,
for ketamine infusions.
good.
And I could not find that here in Michigan. I
Mhm.
found a doctor providing monthly infusions, but they weren't a high enough dose. And he was in the process of actually closing his ketamine clinic, which ended up happening because it's just not cost effective. But the doctor in Florida has figured out a way to make it work.
Okay.
So then I had to work hard to find the money to travel there 3 separate times. I got 10 loading doses. I also opted to get a Mediport put into my chest because I knew that I was committed to this form of treatment for my disease.
Mhm.
And I'm a very hard stick. And another aspect of CRPS is that any further injury to your body can cause it to spread, including IV sticks.
Oh,
And
wow.
in fact, I have read a scientific study that had 20 participants. One of the participants had gotten CRPS in their arm from an IV stick.
Oh, wow.
Oh, wow.
Every time anyone tries to put an IV in me, it's 3 or 4 pokes.
Mm.
Yeah,
And I
so
said,
there you
nope,
go. Right, right. Okay.
not allowing that anymore.
Mhm.
And so that doctor who did used to offer ketamine, I'm very strong-minded and very persistent, and I really urged them to support my journey and help me complete all the prerequisites so that I could get accepted at the doctor in Florida. His name is Dr. Ashraf Hanna. He's at Florida Spine Institute in Clearwater.
Okay.
He's one of the leading experts on ketamine treatment and CRPS in the country. So the doctor here, they followed all the instructions so that Dr. Hanna could get my medical records, do labs, have them sent. They wrote the order for me to get a port put in through interventional radiology. They did everything that I asked them to do, and they moved quickly. It also helped that the doctor there, his name's Dr. Rosenberg at Prism in Canton. He had a pain behavioral therapist, and I signed up to talk to her weekly immediately.
Mhm.
And it was very helpful because she could advocate for me within the office as well. So, and she was doing that over telehealth, and that's about a 45-minute drive from me. So at least I was seeing her weekly and letting her know everything that was going on, in addition to her helping me emotionally cope with this diagnosis and the pain.
Okay. Okay.
So I had to have a caregiver every time I went to see Dr. Hanna, and my mother went with me, and it was a 2.5-week trip. You have to go and see the doctor for your consult on a Thursday. And then the following Monday through Friday for 2 weeks, you get a 3-hour high dose infusion. They start you at a low dose and they continually increase the dose throughout those 2 weeks.
Okay.
I saw immediate results.
Oh, that's great.
Amazing.
Yeah. So, Christine, it sounds like you have, gone through a lot
Mhm.
and spent a
Yeah.
lot of time researching and trying to figure out who's going to be able to give you the best care and all of that. Do you have any goals for this upcoming year?
And is your condition? I hate to use the word remission, but are you currently in like a remission type state, or like in a controlled state?
Because of the ketamine?
It's yes, it's not in full remission.
Okay.
It's in a controlled state.
Okay.
So if I could describe it to you, on the McGill pain scale, which is a more accurate pain scale than just a 1 to 10.
I was the little smiley
CRPS,
faces. Yeah.
CRPS is the most painful chronic condition known to man, and that pain scale goes from 1 to 50.
Okay.
And I was taking the questionnaire pretty regularly to kind of gauge where I was at, and I was between 43 and 50 all the
Okay.
time on that scale.
Wow.
Excuse me one
Now-
second. 1 second. Was that Barbie Engel that had CRPS
I'd have to
with the
look it up.
international
Yeah,
pain? We do have
yeah,
a.
it could be, but
I'm
yeah,
going to send you a link. I just wanted to.
because she's the one that started like the Eye Pain magazine.
Right.
But I can understand how all of your endocrine system, your immune system
Everything's
are
on
affected
alert.
because your body it's basically being tortured on a daily basis.
Yes. The stress, the cortisol,
Yeah.
everything starts spiraling. It's like CRPS is like a computer that you click on something and then it's stuck. That little circle is going around and around and around, and a
Okay,
pain signal is
okay.
continuing, and then you have to hit Control Alt Delete.
And then is
Well, you
the ketamine? Does that wear off? Is that why you have to go back?
Yes, it can and does. You have to continue to interrupt this glitch that's happening in your nervous system. You have to continue. Now, once you get it into a controlled type state, you can get onto a maintenance plan, and that's where I'm at now.
Okay.
I am not in full remission. The CRPS that I had spread very quickly once I was diagnosed. It started out just on the lower right leg. It spread all the way up my right leg, all the way down my left leg, across my chest, my face, and my left arm.
Wow.
Yes. So once I started the ketamine, all of the places it spread to immediately disappeared within the first few days.
Oh, that's wonderful.
And right now, I only feel symptoms from about 3 or 4 inches above my right ankle, all the way down through my ankle and foot, and it no longer has a burning sensation.
Okay.
Well, that's
good.
good.
Yeah,
That's
that's
good.
great.
I feel numbness. I feel tightness, kind of like someone has wrapped rubber bands around it and is pulling and tightening.
Well, the fact that it's injured, you probably aren't moving it as much. So maybe after
Yeah.
the ketamine, you could do PT because the pain is reduced
I
and
did
get
that.
some motion
Okay.
through. Okay.
Yeah,
So
and-
I was in physical therapy twice a week up until several weeks ago when I could no longer physically tolerate it because the POTS symptoms began to take over, and also because long-term disability is trying to deny me and I have not been paid in 2 months.
Oh, geez.
Oh.
So I didn't have even enough money to cover the co-pays to go to physical therapy for my ankle anymore. I saw my surgeon and I am at a point where I can walk, but I cannot tolerate it for a very long time. So as of right now, I have been changed over to my primary care, who has ordered home health for me.
Okay.
I met with a new physical therapist in my home this week, and his main focus is to work on the POTS symptoms.
Okay.
Yeah, because that's
Because-
an added danger for you.
Right.
Yes, anytime I get up now, my heart rate has shot up as high as into the 160s. And luckily, I have an Apple Watch, and I have been tracking my heart rate and noticing more and more and more that there was a problem. And then I became so dehydrated that I had lost 15 pounds.
Oh my gosh.
Yeah.
Is
so,
there a limit to how much you? I know my daughter needs to drink like a gallon a day because of POTS.
Yeah, I was drinking so much water, it was washing the electrolytes out of my
Yeah, that's-
system.
Yeah, it's
and
hard balance. Yeah.
Yeah, you got to
a
balance it,
friend of
right?
mine,
Mm-hmm.
she's a neighbor who has a lot of similar diagnosis to mine, brought over some electrolyte packets by a reputable brand.
Okay.
And so I began drinking those because I was measuring how much I was drinking, and I was up to 5 liters a day, and I still felt like I was so thirsty that I was shriveling up. Once she brought those electrolytes over and I started replacing the salt and other electrolytes, I got a little less thirsty, but I was already contacting my doctor saying, I need help and I need it now.
Right.
I know what's wrong. I know this is POTS. I collected proof. I have it all recorded on my phone, my heart rate and everything.
Mm-hmm.
So I did see my doctor. She got a lot of labs and referred me to cardiology. I had to wait a couple weeks. Finally saw the cardiologist. He 100% believes me. And right now, today, I am wearing a Holter monitor for 2 weeks.
Okay.
So they can
So-
actually keep it, have a record of it.
Yeah, yeah.
Yes.
Just do a lot of this down, up, down, up, down.
No,
Give
don't
them
do
all
Right.
the.
No.
All right.
Yeah,
They
take care of
also-
yourself. Yeah.
Yes, they also started me on propranolol, which is a beta blocker to
Okay.
help control my heart rate.
All right.
And that has helped.
Mhm.
Monday, I just started the Holter monitor yesterday. I'm going to be calling the cardiologist to ask him if he wants me to stop taking that. I can still see a major difference in my heart rate, but it is slightly more controlled on the dose that they have. So they can see that I have POTS. They can see every time that I move, my heart rate does increase. But yeah, we're working on getting that diagnosis officially done and onto my record, but they are treating me for it already.
Okay, good.
I had to go to the emergency room and get fluids one day, and that's when my doctor ordered me to get fluids. For the past couple of weeks, I went to the local infusion center to get a liter of fluids twice a week, last week and the week before. However, I asked for home health. I'm a nurse. I know how to access ports. I can access my own port, and I know that I might end up needing more than 2 liters a week. So she got me started on that, and a nurse came yesterday and accessed my port. They delivered supplies 2 nights ago, and I'm talking to them about being able to do it some of the time myself. They have to send a nurse once a week to my home and deliver supplies weekly, but she's going to talk to her boss, and probably when she comes on Tuesday, she's going to do something called a teach back method, where I demonstrate that I know how to do this medical procedure. It's the same thing like as if you were teaching someone to give themselves insulin. You know, you have a nurse teaching you, and then you have to demonstrate that you can do it.
Right.
I already give myself vitamin B shots, you know, for years now. So it doesn't bother me at all to access my port to poke myself with a needle. It does not bother me. So
Okay. So what are your goals for this next year?
my goals right now are somewhat unclear. My ultimate wish would be to get well enough to work again.
Sure.
But I know that due to the amount of care that I'm going to need going forward, that I am likely going to have to work within a different field of nursing, such as something to do with remote work, telehealth, a nurse advice line, a caseworker, where I could work from home. I don't know my prognosis and how well I'm going to do even with the POTS treatment. I don't know if I'm going to be able to tolerate a whole lot of physical activity going forward. We are currently talking about moving because we can't afford our rent, and our lease is up on February 14th. So my goals would be to get my health stable, to have a good understanding of what I'm going to need for my future, to become more stable financially, and to be in a living situation for me and my boyfriend that is sustainable.
Sure.
And also to be able to maintain having health care, because the company I worked for, they still have not officially terminated me, but they forced me to start paying COBRA rates for my insurance 90
wow.
days into my leave.
Okay.
So I had to take my daughters off my policy. I had to take vision off because it's $700 a month for me right now.
Oh wow.
Okay.
Yeah.
Yeah.
So I had to start a GoFundMe. I've had family and friends sending money I've had neighbors bringing me bottles. I've been going to food drives, food pantries. I have been doing, I emptied my 401k. It's gone. My boyfriend's savings, gone. We have exhausted every financial avenue we have to stay afloat.
Okay.
And my family and friends have helped immensely.
Okay.
Okay.
So
Do
I continue.
your daughters live near you?
No, they live in Arkansas with their dad.
Okay.
Okay.
My first daughter graduated, she had been talking about wanting to stay with her dad for a while. And my other daughter wanted to stay with her sister. She wasn't really that happy at the high school she was at. So they moved with him. And now it's at a point where my older daughter, they both have jobs. They both managed to get themselves a used car. They're both done with high school. My younger daughter has started on a course to become a hairdresser, which will take her about a year. And my older daughter was considering moving back with me after the holidays. However, that's on hold because my living situation
Right.
isn't really that
Sure.
stable right now.
Right.
Sure.
So
And Christine, what advice do you have for someone who's been recently diagnosed with chronic regional pain syndrome?
my advice would be to immediately join groups on Facebook
Okay.
and on TikTok.
Okay.
To not be afraid to be vulnerable and to talk about what's going on with you so that you can meet others. Because I am telling you right now, it is the patients who have this disease that know the most about it.
Sure.
That's understandable.
That is where I have found the most help and the most information quickly. I would also advise anyone that if if you have it, spreading awareness is so very important because I continually meet health practitioners, nurses. I'm in contact with these people all the time. Everywhere I go, I have to teach medical professionals about this disease because it is not taught in school.
Okay.
There are an estimated number of people in this country, about 200,000, but depending on your source, it is so underdiagnosed. Many people go for years without being diagnosed because no one knows about it.
Okay.
The sooner you can get diagnosed, the sooner it's recognized, the better your chances are of preventing spread.
Okay.
I
How
would
do-
also advise people
was-
not to jump into a spinal cord stimulator.
Right.
Okay.
I was going to ask, besides the ketamine, what is the typical treatment plan for this disease?
It's different for everyone because treating it is extremely difficult. I have a friend on TikTok who manages because she was diagnosed very quickly and she continues to get the sympathetic nerve blocks and she uses kratom because it's so hard to continue on with the opiates. Some people are just on opiates. Some people get a pain medication pump with either an opiate or a muscle relaxer in it. Some people opt for medical THC. Some people fall for the spinal cord stimulator and have disastrous results, but I see very few people that get good results. But if you talk to people who have had a little bit good results with a spinal cord stimulator, you will find that over time, they stop working. So my goal was to attack it chemically at its source, at the cells that are misfiring at the chemical level. And ketamine is an NMDA receptor antagonist, and that is the misfiring part of your nervous system. I have videos that explain this on my TikTok at length. I try to explain it in an easy to understand way, but you have to, it's hard on TikTok because people want real quick, they want real quick, videos and answers and explanations. So I try to formulate videos that will at least give people information and attention if they have the patience enough to watch long enough.
Okay.
There are other tools you can use, such as DMSO, that is a topical that comes from like I think some type of wood or paper production, but it's used a lot in like on horses. It's very strange, but it's dimethyl sulfoxide.
Mhm.
It's like it's a liquid, and you can get it on Amazon. I apply that topically if I feel I'm in a little bit of a flare, and that helps tremendously with like the surface allodynia type pain, which is the hypersensitivity you have.
Mhm.
Magnesium flakes in a bath,
Mhm.
those help tremendously. You have a pill is not a plan. You
Mhm.
have to come up with a multifaceted plan to slow this down. You have to treat the complications, and you have to come up with a treatment plan and stick with it. And for me, any advice that I would give anyone would be to find a way to get ketamine. Find it.
Mhm.
Find the way.
Okay.
Because it is the safest, most effective treatment that we have.
Okay.
So, I also take low dose naltrexone, and that is not covered by my insurance and has to be made at a compounding pharmacy. Naltrexone is a drug used to treat addiction for opiates and alcohol, and it's a medication. You've probably heard of a medication that when you're on it, if you take it and then you try to take a drink of alcohol, it will
Mhm.
make you very ill.
Right.
That's what that medication is. But it also treats CRPS in an extremely low dose. So it is not manufactured in 1, 2, 3, 4, 5, 6 milligrams. It's manufactured in 50, 100,
Oh,
200.
wow.
Okay.
It's manufactured in long acting shots to
Mhm.
where if you take an injection of it and then you try to use, it will put you into precipitated withdrawal and you'll be shaking and puking.
Mhm.
So I made the choice to opt to get on that immediately and worked with my doctor to get off the Percocet, which I wasn't on a very high dose at all. It was no problem, and I waited a couple of days and then started taking the low dose naltrexone, and I currently take 4.5 milligrams, one dose at night. I take the ketamine infusions.
Mhm.
I had one on Monday. My dose is currently 600 milligrams.
So you're in Florida now?
No, I'm in Michigan. I went this week to a new Michigan provider.
Okay.
Now, this I'm struggling with because this provider communicated with my other pain provider here in Michigan and Dr. Hannah in Florida, and she agreed to give me the same dose that I was on in Florida.
Okay.
However, she's a psychiatrist because ketamine is also used to
Mhm.
treat treatment-resistant depression, which I have.
Mm-hmm.
So she is able to treat me. However, the way that she can bill it, she ca- she can't get it all covered by insurance. So I had $1,000 copay this past Monday.
Oh wow.
Someone very
Wow.
close to me paid for it, and I
Mhm.
can't really mention who,
Mhm.
but I was not able to pay that, and I'm
Right.
lucky to have people that love me and care about me enough to have done that.
That's wonderful.
Yes,
I have
it
an
is.
appointment. I have an appointment for next month.
Mhm.
I don't know how I'm going to get that paid for, but
Mhm.
the appointment is on the calendar for December 10th. And I'm also prescribed oral ketamine.
Okay.
But ketamine is not well absorbed through your digestive system. If you take it orally, it will only be maybe 20% that actually gets into your body. And I have 3 doses a week to take. And the idea is that you don't want to take it every day because you don't want to become too tolerant,
Mhm.
Mm-hmm.
but you do want to interrupt this glitch in your nervous system enough so that the disease does not progress.
Okay.
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 The third medication I take is dextromethorphan. Dextromethorphan is a drug that is in cold medications as a cough suppressant, Dayquil and Delsum. However, the dextromethorphan that is in those cold medications has a molecule attached to it that is basically just like Wellbutrin. And it also has other medications in it like acetaminophen and a decongestant. I don't need all that.
Mhm.
So my doctor did try to prescribe plain dextromethorphan, and it's not available in a regular pharmacy. So I have to order it Amazon and pay out of pocket for it. That's the
Okay.
only way for me to get a pure dextromethorphan molecule medication. So I take 150 milligrams of that a day. So one bottle off of Amazon will last me 20 days, and that's $20. I also have to pay out of pocket for the low dose naltrexone, the oral ketamine, all of it.
Have you
It's-
tried, what's his name? Mark Cuban's pharmacy?
I don't know who that is.
He's
You can send her an email.
I'll
or
send you
something.
another. I'll send you another one.
And
Right.
we did, while we've been talking, we did look it up, and Barbie Engel is the one who had CRPS from an IV that infiltrated, and she started the Eye Pain magazine and Nervember, which is to try to help raise awareness for nerve pain.
Yeah, I'll send you. I'm going to send you a lot
A
of
bunch
links.
of links.
Yeah. Also,
Great.
we have somebody that we've interviewed that helps people get long-term disability. So I'm going to send you his information as well.
Okay. I have hired a lawyer.
Okay.
So I am signed up for that, and they are trying to get Prudential to pay for my long-term disability. And they are starting a Social Security disability application for me because long-term disability would require that.
Right.
Good.
And I don't have a timeline on if and when I'll be able to work again. So I did manage to get that rolling, and it's been overwhelming. Everything has been overwhelming. But another piece of advice I would have for anyone newly diagnosed is that there is a Facebook group in particular that I am an admin on in conjunction with my friend Nancy, who has had CRPS since the 90s and knows Dr. Hannah personally. It is called CRPS Newly Diagnosed. And on that group, we have files. And Nancy had asked me to write what I think I should tell people to do when they're newly diagnosed. So I spent a lot of time writing a document and step by step kind of outlined the things that you should do so you don't feel too overwhelmed if you're just diagnosed with CRPS.
Oh,
Excellent.
wonderful.
There are
Excellent.
Good advice.
a lot of groups.
Right.
Okay.
There's
Right.
a lot of groups.
Right.
Well, Christine, we're gonna definitely have you on again to discuss POTS in more detail. But we want to thank you for joining our show today. How can listeners learn more about you? Can you share your social media contact info?
Sure. My name on Facebook is Christine Hutchings James, and I live in Michigan, and my profile picture is a picture of me with blonde hair with my black cat, Momo, who passed away more than a year ago. So I'm searchable on Facebook.
Okay.
And I will give you my TikTok. Hold on. I'll give you my TikTok handle. If you search on TikTok at CRPS Phoenix Team Rising, all one word, that is my name is actually, CRPS Warrior, RN, ADHD, MDD, but if you search at CRPS Phoenix Team Rising, my profile picture is an AI image of a phoenix.
Got it.
Okay.
So I have purple hair right now, and if you see the videos of me talking with purple hair, that's me. You
All
found
right.
me.
All right. Well, we will
Wow.
definitely pass that information on. And hang on, don't hang up yet because we got to go over our show notes and then we're going to come back to you. If you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com. We have a website, podcastdx.com. We're also on Facebook, Twitter, or X, TikTok. Well, we might be back on TikTok, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. And always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.
Wonderful.